Hey everyone, I wanted to spend a few minutes today to chat about a question that I think a lot of people have as they're doing their research on lower facelifts and are on social media and websites reading about the different kinds of lower facelifts. I already posted a video about what the D-plane facelift is and why you should know about it, and what are the nuances between the D-plane technique and other techniques. And so let's talk a little bit about this term that gets used a lot, which is vertical facelifting. I think patients should have an understanding about what that generally alludes to when it comes to lower facelifting techniques. But also, I wanted to kind of give you my perspective on it and why I think that maybe people are overthinking this vertical facelift concept to the point where they're really just searching for facelifts that have the vertical word in it. And I don't think that's necessary. So let's understand what the vertical facelifting generally is referring to, and it's really just the direction or the vectoring of the lift. So just right off the bat, most people will agree that you don't want to do a horizontal facelift, right? That doesn't look good. Eye looks stretched, the mouth looks stretched and pulled. It's not the right direction that you want to be pulling or lifting the sagging tissues of the lower face over time, right? So we can all agree that things age vertically because of gravity and deflationary volume loss and skin changes. Most things kind of droop down this way. And so, when we see patients in consultations, they are pretty savvy and they understand their face and they know that, what they want or where things used to be was up or in a more vertical direction. The nuance here is, what direction? Is it straight up? Is it up here? Is it like obliquely up? So those are where the nuances and the different techniques kind of differ a little bit. But I'll tell you that generally speaking, you want to go up in a mostly vertical direction. But when you truly look at the angulation of the tissue that gets released and lifted, it's usually oblique. So it's a little superior and a little bit lateral. So it's in this direction. And most people would agree when they're showing, what they would like done, it's really in this direction, right? The importance of this is also in the technique that you utilize. So a lot of SMAS techniques, which really just fold the suspensory ligament or the soft tissue underneath the skin, they just use sutures and they kind of pull it from this side. If you go too vertical in this area, which is the easier area to mobilize, you get this kind of swept look where things look pulled up here, but you get this little sweep because you're not lifting up the midface, right? There are other techniques that kind of go up vertically all the way here, and that's fine. I'm sure it results in decent outcomes, but truly, as you look at facial aging, it kind of goes in this direction, the direction of the nasolabial fold, as you can tell, right? So it's important in the D-plane techniques for us as surgeons to be able to release the attachments, the very tethering attachments of the SMAS layer up high in the cheek as well. Not just in this area, which is actually the easier part to release. It's really this area here. So that when you lift it, you can go vertically, but you can also get a lift in the mid-facial tissues, which is really, really important, I think, in a natural and comprehensive lower facelift, where you get a little bit of mid-facial lifting and volumization in the mid-face, as opposed to just in this one little area here. And it can look good, but in a more comprehensive approach, it's better to release this area too and lift that at the same time as the lower part of the face, right? And so I just wanted to clarify that, generally speaking, most people who do D-plane facelifts are lifting the tissue in a generally vertical direction. The tissue planes will tell the surgeon where they want to go. It's pretty obvious once you're in there and everything is appropriately released. The tissue will kind of tell you where it wants to go, and that's where you resuspend things. Try not to do it under tension, because once you do all the releasing, as I said, that tissue will just fall into place. There's some areas where there's maybe a little bit more tensioning needed, depending on the patient and what's going on in the marionette fold and jowl region. But just know that generally speaking, it is a mostly vertical direction. Most of the lower facelifts and D-plane facelifts do that. And so don't get so bogged down about, oh, is this a vertical facelift, or how come, your facelift is not called a vertical facelift? So just know that